To our top story, we are not yet out of the woods, and neither are we out of the third wave. This is according to the Ministry of Health, as it sounds an alarm over the Delta variant that has affected many countries across the world. The Ministry of Health has warned of more counties reporting increased COVID-19 infections, with the Delta variant being a key concern. NTV's Helen Aura brings us more.
With Kenya having recorded 3 variants of concern, the Delta variant, which is highly contagious and has sparked a catastrophic wave in many parts of the world, is now a major concern.
The dominant variant, irrespective of counties in this country at the moment, is the Delta variant. We are already in it. In terms of the spread, it is spreading faster than the other variants were spreading.
The positivity rate in Kenya is on an upward trend, and the Ministry of Health further stresses the super spreader variant is more dangerous and insists the public should not drop their guard. Kemri had projected a possible 4th wave by July, a projection which the ministry has now countered with a significant stuttering wave in play.
We never actually came out of the 3rd wave completely, because we never had a sustained positivity rate of less than 5% for 14 consecutive days. So we have had peaks and troughs.
Daily figures of the infection rate released by the Ministry of Health from the 13 zoned western counties differ from reports from various health stakeholders.
Hospitalization is one of the key indicators of what is going on with the pandemic, because the higher the hospitalization, the more the disease burden in the society. The higher the hospitalization, the more stringent the measures should be, because if hospitals are overwhelmed, it means you can't cope. And that is what's going on right now in Mombasa. Mombasa is overwhelmed. You go to Kisumu, is overwhelmed. Yet you and I, as ordinary citizens, when you look at the data from the ministry, it gives a rosier picture.
5 more counties have been mapped out as counties with increasing COVID-19 infections. Nairobi, Kiambu, Uasin Gishu, Mombasa and Kilifi are now on a watch list.
Zamani ilikuwa tunapata kisa kimoja kwa pengine siku moja ama viwili kwa wiki mzima. Leo hii kila siku Kilifi haishuki chini ya watu 25 kwa siku. Tusingoje mpaka tufike ile kiwango cha India.
Reports on the low testing capacity in the country remains a challenge, with the country experiencing supply chain problems during procurement. Kenya is also facing a shortage of vaccines as countries weigh mixing and matching as an option. So far, 1,052,343 people have received their first dose of the Covishield, while 640,450 having been fully vaccinated.
Because of paucity of vaccine doses, if you get Pfizer vaccine, there's nothing that will stop us from practicing mix and match.
Kenya is set to receive 1.8 doses of Pfizer, with an additional 13 million doses of Johnson & Johnson set to come in by August. Helen Aura, NTV.
All right, well, these statistics should put things in perspective for you. 1,006 more people have been infected with the coronavirus, and this puts the total number of positive cases at 199,941. The positivity rate today now stands at a very high and worrying 18.0%. 13 more late deaths have been recorded, while 261 people have recovered in the last 24 hours. 174 people are battling to survive in ICU, and on your screens, the number of those vaccinated coming up. There you go.